Dr. Zaibak, you said you do see children. Tell us a little bit what a mom who maybe has her first baby or maybe her second anyway, what suggestions would you give her, like when to bring the child to the doctor, to the dentist, I mean, what should she do or not do with the baby? Shed some light on the story.
Well, from my experience, a lot of parents sometimes threaten their kids when they're bad that they're going to take them to the doctor or the dentist. That should never be an option. Never should be an option.
Really? That still happens?
It happens daily, and you're not doing any good for your child if you do that. The dentist, first of all, you should start sending your child to the dentist to get introduced to him at age 2 or 3, and basically you're introducing him to the dental environment. Not that there is anything going to be happening at the dental office. We just basically check their teeth. We count their teeth. We make it like a fun experience. Let's count your teeth. This is a tooth counter. This is the mirror. This is a light. We're going to put on your mouth, and make it like a fun experience. And as they get older, they're getting comfortable, and when they do, and if they do get a cavity, at that point, they'll be more comfortable getting it done, and the experience will be much more pleasant.
So it's really just get them to the dentist to basically ride the chair up and down, play with it, and realize that this is actually a safe environment.
Yes.
That's it. Now, what about at home? What about at home in terms of nursing, in terms of maybe brushing the teeth? How should parents go about this whole thing to make dental hygiene something which is normal, natural, and maybe even fun? I might be exaggerating here, but...
Well, immediately, once they get their first tooth, you should somehow clean it. There is different products out there. I know when I had my first child, her first tooth, there was like this rubber finger with bristles on it, and then you just go and you clean it. Eventually, my child now, who's she's 2 years old now. She asks the minute she wakes up in the morning, I want to brush my teeth. You get them used to it. You immediately when they get their first tooth, and it becomes natural. And don't give them candy. Stay away from those type of things, because if you start a habit, it's going to be very hard to break it. I know that's very important.
Okay. Some dentists have drawn attention to that. They call that the bottle syndrome or something. Well, what is that?
Bottle tooth decay. You should never, ever, ever let your child sleep with a milk bottle. And milk has a lot of lactose, and is full of and it can corrode. It can decay your child's teeth significantly. A lot of parents give their child just about to sleep with it. I understand why now that I'm a father, and it's mainly to kind of basically their child starts to cry, so it's kind of a way to kind of stop them from crying. But you're not doing any justice to them, because over and over we see this bottle tooth decay with children coming in with extremely decayed teeth to the gum line because of they're letting their children sleep with the baby bottle. If you're going to have to, just exchange, rather than having milk in it, maybe put water, let them sleep, instead of the milk.
Okay, I got it. Well, at least the milk, I'm not so sure it is better, but it looks like better than what lots of people in Europe used to do to shut up the little guy. They put the lollipop into some wine, some fresh made new wine, and I'm not kidding actually either. There's in the farmland in those areas, in at least about, I would say, probably the generation before my generation, or slightly younger than me, there was a fair amount of people running around being a little bit dumb because they were drunk every day as kids.
Wow, that makes for a happy baby, I guess.
Yeah, well, it made for a quiet baby. So anyway, Good. Well, wonderful. So it's not a really big deal. Go there and just introduce the kid to the dentist, and it will all be fine. All right. Thank you very much.